Hi, I am Dr. Rubin. I am a general pediatrician and breastfeeding medicine specialist and owner of In Touch Pediatrics and Lactation, serving the suburbs of Chicago. And grunting is something I hear a ton about. I hear frequently about babies, newborns, up to about 2-3 months maybe, who are, parents report that their baby seems really uncomfortable at night, won't sleep, it's just grunting and moaning and pushing, and baby can't sleep, parents can't sleep. It seems like baby's in pain. Parents are wondering if they should change the formula, or if mom is breastfeeding, should she take something out of her diet? Is it something that the baby's sensitive to? Is the baby sick? Does the baby have reflux or gas, or what is going on? These grunts easily get interpreted as something wrong in the tummy pain. And amazingly, I hadn't really heard about this earlier in my career very much. I don't know if parents just weren't bringing it up, or maybe I was blowing it off and I didn't realize it. But once I had kids of my own, I experienced this and I was baffled by it. I took a recording of my daughter doing this in the middle of the night, and I want you to listen to it and see if it is something that you have experienced. Hopefully you'll be able to hear this, okay? Okay, that's probably enough of it for now. Hopefully you don't hear my dog barking in the background as well. So that would happen just about every night. We'd put her down and we'd hear that through the night. And the funny thing was, when I looked at her, she was asleep. She actually sounded in distress, but was definitely sleeping through this whole thing. I was having trouble sleeping, but she was sleeping fine. So after I experienced this myself, I started to hear more parents mention something like this, and I would pull out my phone and play it for them, and they'd be like, oh my gosh, that's exactly what my baby is doing. And honestly, this is not proven anywhere. So this is not evidence-based. It's more anecdotal and experience-based. But over time, as I have heard this more, it's something that I believe is a developmental stage. It's something to do with a baby's immature neurologic system. And this happens as babies mature over time. So it seems to start maybe between age 3 to 5 weeks, or kind of maxes out around 5 weeks, and tends to go away on its own over time, maybe by the time babies are 2 or 3 months old, if even that long. And the interesting thing is babies seem to be asleep through the whole thing. And ultimately, they just grow out of it. So over time, I've stopped treating it. I've been able to reassure parents that this is normal. It's a phase. They will grow out of it. It's not reflux. It's not pain. They are fine. They are sleeping. The conundrum is, how do parents deal with this? Because it's distressing, and just hearing that, it's really hard to sleep. So there's a few ways to deal with it. One is just kind of know that there's nothing wrong, and hopefully your brain will be able to kind of phase it out, and you'll be able to sleep. Another option is simply sleeping in a separate room from your child. And of course, this is not what is recommended for newborns. It's now recommended by the AAP for babies to sleep in the same room as the parent, and that this is best for breastfeeding, and it is best for prevention of SIDS or sudden infant death. But we also have to deal with reality, and a parent who cannot sleep and get, we only have little chunks of sleep anyway to be able to get. So just to tell you what I did was I put my baby in her crib, so in the next room, and I put a monitor there that I figured out a volume so that I was comfortable that I was going to be able to hear crying, but it was still too low for me to actually hear the grunting. And it worked. And at some point, it just got less and less, and it finally went away. In the meantime, I had tried reflex medicine. I had tried different positioning. I had tried the gas drops. I had tried all of the things that previously I had typically recommended to patients in this situation, and none of it worked. And really, the more I hear about it, the more I am convinced that it is a phase, and it's kind of a frustrating phase as a parent. The funny thing is that when they're being held, if they're being held to sleep, they don't do that. And then oftentimes even during the day, if you put a baby down, they don't do it. It's really a middle of the night thing. So it could have to do with, the neurologic system, kind of like the startle reflex, that it is kind of controlled when a baby's being held, but it becomes more prominent in the night hours or during when the baby's not being held. It could have to do with the circadian rhythm and night versus day. I'm not really sure. Maybe I'll do some research on this someday and figure it out. But in the meantime, my main point of making this video is for those of you who are going through this. This is a tough time for so many reasons, these first few months. But when this comes and you really feel like something's wrong with your baby, it can be very, very difficult. So obviously, if you're really worried, certainly talk to your pediatrician about it, because, there are times when babies are having problems or reflux or pain. So we don't want to completely discount this. And there may be certain patterns that will make your pediatrician be able to reassure you or to decide to try some sort of therapy or need to work it up. So I'm not saying ignore it, but for the most part, in most situations, at this age, this is something you can expect to happen. And if it is happening, be reassured that there's nothing wrong and that it will get better on its own. Babies invariably grow out of it. Just have to kind of figure out a way in the meantime to be able to get as much rest as you can. And it's okay to make some changes that may not be by the books, except back to sleep. Baby needs to be on the back to sleep no matter what. So that is one thing that you cannot change, okay, when we are trying to relieve this grunting. All right, so hope this has been helpful, and I hope you can get some rest tonight. Have a great night. Bye-bye.